when you have chronic inflammation, some of this cartilage, which acts as the quote flexible bone in these larger airways, becomes more floppy. So instead of like a rigid plastic ring, it will maybe irregular thickness. So then this may start looking like this.
Kind of closing up.
Closing up when you cough and whatnot, or if you don't take deep breaths to keep that airway open, because this space is kept open by the force of air coming in and out of the lungs.
Okay.
It's that volume of air that helps push it out, like if you're blowing a balloon. That's what keeps this kept open, because even if we maximally exhale all the air out, there's still air in there. And the air in there helps keep this from completely collapsing. The normal lung, what may look like this when it breathes. So it can expand and contract. So that's why I said this is like that flexible, semi-rigid plastic ring where the muscles squeeze. It's still, but it won't completely shut off. But then it bounces back once the muscles let up. The bronchomalacia that he saw when he got the bronchoscope and then looked at some of these major airways were more floppy. That's what the malacia describes.
Mm-hmm.
So floppy is if there's secretions, you could see that they're really close together. So when this gets contracted just a little, it's as if you're putting a drop of water in like a Ziploc bag. You can see it start to blow together and then sticks.
Yes.
So that explains that rapid decompensation. When you go home, you're at 2 liters and all of a sudden you're at 9 liters and can't breathe, and you're checking your oxygen levels and it's super low. Why? Because this turned into this messy looking lung here that completely closed up on itself. And it's just itty bitty airway allowing air to come in and out. It takes a lot of force to overcome that resistance of that thin layer of water. If you don't believe me, put that drop of water in a Ziploc bag and try to blow it open or peel it open. It takes a lot of force with just that couple drops of water. Your lungs are the same way. So if we know these airways are floppy and there's certain things we can't change, because one, you still want treatment for this cancer, reasonable, right? At least for now, to see how it goes. So we're not changing that. You still want to treat the pain, at least at a base level for cancer.
Yes.
So you might still aspirate, so that won't really change. What we can do is, my goal is to hopefully decrease the amount of secretions you have here, to limit the amount of times they can come close to each other, close enough to them suddenly stick together. So how do we do that?
Antibiotics.
Well, antibiotics help when you get into with trouble. So that's how. So increase the PEEP. What the PEEP is a positive end expiratory pressure. That's a residual pressure that's in the lungs after you maximally blow out. And that's accomplished by using the flutter valve and incentive spirometry. This is the incentive spirometry, and if you feel when you suck in and maintain a certain level, you feel pressure in your lungs, it's because it's raising that PEEP to keep things open. The other device that we could use, it's a flutter valve. It looks like a giant whistle with a bulb syringe at the end. And when you work on that, that helps increase the flow of air within your airways, as if you were to take a leaf blower and a puddle of water. So it's helping to move it hopefully in the right direction out. Mucinex helps make the whatever secretions are there more liquid and less viscous. So with the extra force, you can hopefully clear it up and out of your lungs. And this is what we refer to as a pulmonary toilet. How do we keep the airways clean? Flush it, right? But how do we flush it? Make it more liquid and do exercises to force movement, hopefully in the right direction. So that's the best I have to offer until we see there's other things that we may need to tweak. That's the easiest thing to do as well. It just takes more work on your part to do that stuff.
At home.
Right, but that may include incorporating that flutter valve, because this works on one aspect, keeping it open when you're supposed to be breathing out. The flutter valve helps clear the gunk that's still there
Okay.
out of the lungs. And hopefully my bad dancing is putting a visual on what's happening in these tiny little airways. That's a
helping to
whole lot of
understand
college and medical school physiology of your body, hopefully in layman's terms on what I'm trying to accomplish.
Mm-hmm.
But does that make sense how quickly you could feel awful like a drop of a dime?
Mm-hmm.
Right, because you breathe all the time. You're not going to stop breathing until you die, and hopefully you don't want to die anytime soon, so we have to find some way to keep it open.
I don't want to go anytime soon.
And sometimes, even with the best of circumstances, you may need to have occasional procedures to wash out the lungs. The purpose of having the lungs coated with a viscous, sticky material is in the air. We may not see it, but there's always particles there. And those particles cannot muck up the fine air exchange that happens really deep in our lungs. So with greater distance, some of these fine particles start settling out of the air, and then they get stuck like a fly trap on the sides of the airway, and then your body then works in clearing it as that gunk starts building up. So we still want secretions in your airways, we just don't want too much, and secretions that are there, we want them to move in the right direction. Okay?
Let's